The number of patients accessing dialysis services in public hospitals has shot up dramatically, according to data from the Ministry of Health. And perhaps noticing the gap, Issac Mulindi has come up with a hospital to settle part of the problem by opening a dialysis hospital and the services for free.
And what we are doing is to offer free services up to February and supporting the activism as far as the gender violence of women. We want to say the women should not cry. In this support, we want to offer also free renal dialysis to the patients. If you're a woman, come for free. This facility is here for you, the doctors are here for you, and we know with this kind of support, we'll be able to go far.
Within the 16 days, remember, we talk about gender-based violence, but there are many violences now that are not just gender-based, but they torture you. Those are violences of health, where you go into a hospital and you'll find you go through a process. By the time the doctor is giving you, the hospital is giving you your bill, you cannot believe that you're paying for the scissors that you used, you're paying for even when you go through personally in that bill and you walk back to the cashier and you say, I want to see why I'm paying, give me my scissors, give me all the things you've charged me. They will not. And so it is time also, as the government is raiding in other places, it is time we raid health.
From 700 sessions a month in 2015 to over 400,000 sessions over the same period in 2020, all the 54 renal units countrywide have registered growing demand. About 1,458 kidney patients are currently registered for dialysis countrywide, with Moi Teaching and Referral Hospital leading with 172 patients, followed by Kenyatta National Hospital with 166 patients, Nakuru Level 6 Hospital with 89, Kenyatta University Teaching, Referral and Research Hospital with 72, Machakos Level 5 Hospital with 54, and Murang'a County Referral Hospital with 59. Issac's hope is to add 8 more facilities to help Kenyans who are in dire need.
Our budget is to do at least 8 facilities in the country so that we can be able to reach out to as many people as we can. So my motivation is to kind of try to see to it. It's not only money-minded. We know that we need to cater for the people that are working, the nurses, the doctors and stuff, but we want the doctors to know and the nurses to know sometimes giving back is something that goes a long way.
Dialysis helps when your kidney fails in that it removes salt, waste and even extra water so as to prevent them from building up in the body. It also helps in keeping a safe level of certain chemicals in the affected person's blood and also control blood pressure. Dialysis can be quite expensive, with over 4 million Kenyans suffering chronic kidney disease, with a significant portion of this population progressing into kidney failure.
So there is nothing you can do about it unless you dialyze. We want to give them hope. We want to be able to be the ones that support with other like-minded people who have the same facilities, just to partner in the nation and tell those people that are going through this particular kind of disease that we are here. So this motivation is there because we know most people don't have this kind of issue.
And so when someone is doing a dialysis, for example, and most of them are using NHIF, and so in a facility like this, as much as Issac would want to really support, you see, everyone comes and says, I'm unable to pay because I normally use NHIF. And I know he's going to face a challenge. People will be asking, why is he charging 6,000, yet we charge 9,000? So I want to tell the president, just the way you've opened up milk, please open up this health sector.
The National Hospital Insurance Fund payments for weekly renal dialysis procedures have more than tripled in the last 4 years, from 1.2 billion shillings it paid for dialysis in the financial year ended 2017 to 3.8 billion in 2021. NHIF members are entitled to 2 weekly sessions of dialysis, pushing the total annual payment per patient to an average of 960,000 shillings at the current rates. Out of these, about 10,000 people have end-stage renal disease and require dialysis, yet only 10% of those who need it are able to access it. According to NHIF, dialysis is its single largest medical insurance claim, with the payouts for treatment of kidney failure increasing by 41% in 2019 and the agency releasing 1.8 billion shillings.
Even you find you go to hospital, then you are told you have to go to a certain place. That is where you'll get that. And you ask yourself, why would I jump all these other facilities and go there? So if the government wants to achieve healthcare in this country, as they say, then we must look at all these things. It's not just about equipment.
We can offer up to 17 machines to be able to support the renal patients that are suffering. So what we are saying here is, you're welcome at this facility at any particular time. You feel you want to dialyze, we want to welcome you and offer you the best, and it's for free at this particular time, up to February.